physicians and surgeons and is on the line with us right now. Dr. Rowe, hi, thanks for being here.
Hi, Gloria. I'm happy to be here.
So what are the reasons behind this announcement now?
The college, I think, has an ongoing requirement to contemplate licensing processes, and we've been doing a lot of that work behind the scenes, looking at different licensing processes. And what we took to the board 2 weeks ago was a proposal to amend the U.S. certification requirements. I think it's exciting, good news, and it's really part of meeting that requirement to modernize and evolve our licensing processes to ensure that we streamline the processes as much as possible.
Okay, well, can you give me your assessment? I mean, how is our healthcare system doing right now, in your view?
Well, Gloria, as somebody who's been in practice for 30 years, I can tell you it's tough out there. I think primary care is struggling. We have far too many members of the public who cannot access primary care. At the same time, we know that our specialist colleagues are struggling with long wait lists, and there's access issues with regards to getting patients who have managed to see a primary care physician into specialist care. I think, as you know, and as we hear often on the news, the issues are widespread and they're challenging.
Right. Okay. So you're targeting American doctors right now, or in the United States. Why there specifically?
Now, so I think when we're looking at modernizing licensure and registration, then obviously we look across the board. One of the unique elements with U.S. trained physicians and the way they have been licensed so far is that there are multiple classes of licensure that American physicians have access to, and because of that complexity in particular, it was an area where my team and I were able to look at and think, is there opportunity here to really simplify this process and still achieve our mandate? And it seemed clear that having multiple classes of registration was just ripe for opportunity for removing some of the complexity.
Okay, so it's easier to remove the complexity with doctors in the United States as opposed to elsewhere?
I think that's one way of saying it, yeah. I think, again, we had these U.S. certified classes, and we still do, so we have 4 different classes of registration for 4 different types of U.S. trained physicians. And on top of that, we have the provisional category of registration, which we would also use to try and license U.S. trained physicians. So right away, you can see there's 5 classes of licensure for a group of physicians all coming from one country and a very similar training system. So taking it from 5 to 1 seemed like a real opportunity.
Okay, well, but the licensing process, as you point out, is there to ensure a standard of care. What are we risking when we simplify the process or fast-track the process?
I think the requirements that we've placed into the proposed bylaw revision speak to meeting that safety mandate that I think is fundamental. It's obviously fundamental to the role of the college. So we have quite specifically highlighted that we are looking to offer this opportunity to U.S. trained physicians who've gone through accredited postgraduate medical education programs and have achieved board certification either in family medicine or board certification in their specialties. So we've really started marking out all of those fundamental requirements that say this physician went through a program that is recognizable, that has competencies that are aligned with the competencies in the Canadian system, and has successfully achieved their certification through that process. So we think that this kind of organized process and being certain that they've gone through that accredited program meets the mandate of safety. We know that our colleagues in Nova Scotia and in Ontario have also been licensing U.S. trained physicians into full licensure and have reported no extra safety risks attached to that rest of the conversation, we're leaning heavily into all routes to licensure, and we're doing that both internally at CPSBC, but also nationally with our regulator colleagues sort of across the country. Clearly what we need to do is two things. One, we're looking for opportunities to simplify. We're looking for opportunities to highlight where there are steps that are not required. So as an example, in the current package of bylaw revisions that have gone up for consultation, you'll notice a change in one of the examination requirements for all internationally trained physicians who have achieved full certification in their home countries. So we are engaging in those conversations as well, Gloria. Very complex, obviously. Every country is different, but we are partnering with our sister colleges. We're looking at opportunities through the Canadian certification bodies where they put in the effort to certify other countries' training systems as being very similar to the Canadian system. So those are the windows of opportunity that we see coming next. But obviously, you sort of go through these in a stepwise fashion, and it just happens that the U.S. trained group were the most amenable to a bylaw revision.
Okay, and what's your ultimate hope in terms of the effect this could have on BC's healthcare system?
Well, I think that my hope is that as a partner with health authorities and with the Ministry of Health, that when they are doing their efforts, their much needed efforts to lean into physician recruitment, that we have offered that streamlined process to support their conversations. As a physician, as a parent, as a son in this province, I obviously have the same hopes that all of us do, which is a robust health human resource that can provide the care that the population require. And as the leader of the college, my hope is keep our processes simple, streamlined, approachable, so that when those recruitment conversations are taking place, it's simple for the recruiter to say to the physician in front of them, this is straightforward, and these are the steps, and this is how it's done.
You know, what's going through my mind right now, I can't help but think of what's going on with our relationship with the United States, and the argument as well against moving here is that our dollar is much lower, the cost of housing and the cost of living is much higher. I mean, potentially a physician from the U.S. would be walking into a healthcare system that's currently strained, as you acknowledged off the top of this conversation. What is there here to attract them to move to BC?
Well, and I think that's going to be the task that's in front of the ministry and the health authorities to craft that package that would be enticing to physicians.
A package as in money?
I think as somebody who's been in practice for a long time, I would say that decisions about where you practice are not just based on money. And so I think that successful recruitment of physicians really needs to look at all of those pieces. It's obviously partly what are you paid, but it's also what is the lifestyle, what are the services that are available for your family, for your children, all of that full package of recruitment. We've seen some real success in communities across the province as they've innovated around recruiting physicians, including family physicians, and it's those innovative ideas that go beyond just what are you being paid.
I'm sure there are other forces at play right now that may tip the scale in favor of British Columbia as opposed to depending on where they're living in the States. What do you think?
Well, I think there's a lot at play at the moment. I don't disagree.
Right. Oh, and just, before I let you go, how challenging is it for doctors to move between provinces in Canada right now? We keep talking about taking down those interprovincial barriers.
We sure do, and we've been